Hey guys, it's Dr. Amelia here. Today, I want to talk about a very common dental problem. Teeth grinding, also known as TMD or Bruxism. Now, you might think that tooth grinding is just a harmless habit, but it can actually cause serious damage long term to your teeth and your jaw. It's often caused by stress, but it can also be due to misaligned teeth, sleep apnea, or certain medications. And for a lot of people, they don't even realize they're doing it until their dentist flags it with them. So how do you stop grinding your teeth? The first step is to identify the cause. And this is easier said than done. Your dentist can help you figure out where it's coming from based on a series of questions and clinical examinations. Sometimes they'll ask you to keep a journal. And this is to pinpoint when are you grinding your teeth. Are there any possible triggers like stress, food, certain types of drinks? Once we've narrowed it down to the cause, then we can figure out what the best treatment is for you as an individual, because when it comes to grinding your teeth, it is not a one-size-fits-all situation. If stress is the issue, which tends to be the most common cause, as a dentist, I'll recommend to people ways that they can find to manage this. The start point is to look at the big picture and recommend referral to a psychologist or a counselor or a therapist. They specialize in cognitive behavioral therapy to help manage anxiety and stress. They often recommend relaxation techniques like breathing, meditation. Stress is very often physically expressed by people. And this physical manifestation can be quite difficult to control. A lot of the time it's unconscious. So if you don't realize that you're doing it, it's very hard to stop it. This kind of stress will often impact the group of muscles that control the movements of the jaw and allow us to chew and grind food. These are called the muscles of mastication. And these muscles include the masseter. This is the main muscle used for chewing, and it's located on the side of the jaw. The temporalis. This muscle is located on the side of the head and helps to elevate the jaw and close the mouth. The medial pterygoid. This muscle is located inside of the jaw and helps to move the jaw from side to side. And the lateral pterygoid. This is located on the outer side of the jaw and will help to move the jaw from side to side and to open the mouth. Together, these muscles work to move a range of motions throughout the day. If you're overloading these muscles, it can do damage. If this is the case, your dentist may recommend the use of a night guard and Botox. A dental mouth guard is a physical barrier that fits over the teeth whilst you're sleeping, and it helps to prevent clenching and grinding. It works by creating a physical barrier between the teeth, which helps to absorb the force of grinding and clenching and prevent further damage to the teeth. I often say to patients, realistically, you are going to wear through your night guard if you have a propensity to be clenching and grinding, but it's a lot easier to replace a wafer of plastic than it is to replace lost tooth structure. When it comes to mouth guards, there are so many out there. You can have hard splints, soft splints, hard soft splints. I really love the new wave of resin printed night guards because they're a lot more comfortable than your classic hard night guard. I remember the first night guard I had, it took me like 15 minutes to put it in and it was so painful. And then in the morning I would freak out because I couldn't get it out of my mouth. We have changed that. The mouth guards we have nowadays are much more comfortable because we use 3D scans. So it's really, really accurate and it fits beautifully and snug. And the material almost has a little bit of give even though it's hard. What I find, in 90% of the cases, a soft mouth guard will be fine. But in some cases, it can actually make your clenching and grinding worse. You sort of bounce on that soft squishiness of the guard and you end up actually making these muscles bigger in the process. Botox, the popular treatment for wrinkle reduction, can also be used for clenching of your teeth. How does it work? When injected into the masseter and temporalis muscles, Botox can relax the muscle and help to decrease and atrophy, which means to shrink that muscle. Not only can Botox alleviate the discomfort and the pain caused by bruxism, but it will also help to protect the teeth from further wear. It's typically reserved for people who suffer from a lot of chronic pain and headaches associated with bruxism, myself included. I would get terrible migraines. You do need to use a fair bit of Botox when you are injecting. We are using the whole bottle of Botox We're talking 60 to 100 units. And that's how much you need because those muscles are so incredibly strong. And one of the common oversights is that they will inject the masseter, but not the temporalis. And they work in dual action. So if you knock this out, this is still working. So you can end up with worse migraines in this area. Every time you're biting down, you're expressing 70 pounds of pressure per centimeter. So you think about how many times you chew during the day, that's tons of force. Coupled with if you are a stress head and you're clenching during the day at work or you're grinding your teeth in your sleep, that's a crazy amount of force to be putting through these little teeth. With Botox, it doesn't last forever either. So that's why I personally like to couple it with a splint because you're knocking out that muscle, but you will come back because you'll build it back up due to the habitual nature of clenching. So the splint or the night guard can slow that process. It always makes me laugh. There's certain patients that as soon as their Botox wears off, they're back in the chair like that. And as soon as it kicks in, it's like a holiday for them. It's honestly life-changing for people who have serious clenching issues. If it's a case that your teeth are misaligned or there's a jaw size discrepancy, your dentist can help you. It might be a case of them referring you to an orthodontist or an oral maxillofacial surgeon. It really just depends. If it looks like it's caused by sleep apnea, we as dentists can also help you find a solution. We act as a referral pathway because sleep apnea is quite complex. There are 3 types of sleep apnea. The first type is obstructive sleep apnea, also known as OSA. This is a common type of sleep apnea, and it occurs when the muscles in the back of the throat fail to keep the airway open despite the effort to breathe. The second type is essential sleep apnea, CSA. This type of sleep apnea occurs when the brain fails to send proper signals to the muscles to breathe during sleep. And the third type is complex sleep apnea syndrome. This type of sleep apnea is a combination of the 2 types. It can be very difficult to treat. Clenching and grinding can actually be a warning sign for sleep apnea, and it's a really serious medical condition that should not be left unchecked. In some cases of the first type, obstructive sleep apnea, your dentist, once you've been referred off to have a sleep study conducted, may be able to treat that with a special type of mouth guard called a maxillary advancement splint. But sleep apnea is one of those things where you need to know the exact cause because you can spend a lot of money and time going down lots of different roads, trying lots of different things that may not work for you. So your best bet is to be referred to a sleep specialist who can help you. In the meantime, there are a few things at home you can do to prevent grinding. Avoid hard foods like ice or hard candy. Avoid caffeine and alcohol in the evenings because it can either increase your anxiety, which means more grinding, or it can reduce the tonicity of the muscles in the jaw, which can also impact grinding. If you're not sure if you clench or grind, there's a few signs. These include dull headache, especially in the morning, and a sore jaw or face. You may also notice tooth sensitivity, or a change in the way your teeth are fitting together. Another big telltale sign is often people's partners will notice that they clench or grind, and it drives them insane. If you think you might be grinding your teeth, talk to your dentist and take steps to stop the habit before it causes long-lasting damage. Particularly when people are young in their 20s, you've got a lot of life to live ahead on. You want to do everything in your power to protect those teeth because enamel is sacred. Thanks for watching. I'm the 10th dentist, and I'll see you in the next video.